Hi, everybody. Will you do me a favor and type in the question area if you can hear me? Awesome. Thanks, Bree. I'm just going to wait like a minute before I start. To the whole thing. I would love to be able to tell you where to get the recorded session. I am going to assume if you registered for this, you will get a link afterwards from Heartland because it is recording. Trying to get a hang of these questions. Hi, Devin. Yeah, and I completely understand being in the end of February. I'm sure everybody's super busy at their salon or for their salon. So I appreciate you all taking the time. Okay, we're going to get started. I will try to answer questions as they come in. It's a little bit difficult for me. Okay, now I see it. Okay. Okay. All right. So if you have not heard of me before, I am Kristin Smithers. I own Sunny Shores Spray Sun and Spa in Northeast PA. I've been owning it since 2019, and prior to that, I managed the salon for 3 years. And right within like that first year of me being a manager at a tanning salon, I hurt my knee moving an old metal Viper bed, and my doctor sent me to physical therapy because my x-ray showed that everything was okay. Going through physical therapy, it actually made my knee worse. And the one thing that my physical therapist would do to help me out was he had like this lighted wand that he would use. And I asked him after the third session that actually helped me what it was. And at the time, he said it was a cold laser. And that's one of the ways red light therapy has, it's one of the names for them. Anyways, I became obsessed with red light therapy. Turns out I ended up having really bad arthritis. I had chunks of cartilage just flaked off inside my knee, which is why it was making physical therapy was making it worse. But as soon as I found out what red light therapy was outside of, oh, you can add it to tanning, I just went down that rabbit hole and I never stopped learning. So I went to Photonic Therapy Institute to get my certification. I went on to get my board certification through bands. And at the end of the slide, I'll show you how you guys can get a free course for that. But pretty much, I'm trying to get the tanning industry on the same page when it comes to red light, because there is a lot of misinformation out there. There's a lot of terrible advice that I've seen from so many different platforms, so many different people, professional or non-professional. And I just want everybody to be on the same page because as an industry, we're really growing and we have the chance to be top-notch providers of this service as long as we're getting the right facts out there. So the first thing that I really want to go in on is why red light works and why our bodies need it. Give me 1 second. I'm trying to hide a screen over here. Can somebody tell me if you only see my screen or do you see like my taskbar at the bottom? You see the task. Let's see. Did that erase it? I hope. Okay. First, the little reflection. One of my favorite quotes from Harry Potter that deals directly, I think, with light therapy and us providing sun is happiness can be found even in the darkest of times if one only remembers to turn on the light. I love it. It's motivational, it's spiritual, it's Harry Potter. If you're a millennial like me, it's amazing. To start off, our body should be amazing at taking in food and energy, having our systems use it. Our cells are all happy and healthy and functioning normal. But as we go on or just live day to day, that process declines. So injury, disease, toxins, chemicals, lack of sleep, aging, it debilitates the body's ability to actually use that oxygen to heal and regenerate tissues. Whoops, clicking too much over here. Um, we prevent our body from saying like, okay, this is an appropriate amount of inflammation, and then inflammation goes higher, pain goes crazy. So our body's supposed to be amazing at supporting its normal body functions, but little things here and there, and then big things will completely stop that from happening. Now, one of the big reasons why our body messes up day to day is free radicals. A free radical is an unstable molecule. It's highly reactive. It negatively impacts and damages other molecules, DNA, proteins, cell membranes. And in a normal body, it's just byproducts of metabolism. So in a normal setting, free radicals are there for a reason, but they are sourced internally and externally. And internal triggers are things like illness, cancer, infection, stress, exercise, inflammation. Exercise seems like a weird one when you're putting it with all the others, but if you've ever overdone it on a workout, you know exactly what I'm talking about. And then other triggers: pollution, unhealthy food, certain oils, smoking, alcohol, certain drugs, not just illegal drugs, but medications that we're taking. So at low levels, they are a part of our body because they help defend against sickness and illness. So phagocytes actually absorb free radicals and turn them into little like helpers for our body to combat illness, disease, microbial infections. Now, they're very important in cell signaling. So these are pathways that are completely controlled and carried on to help with thyroid function, smooth heart muscles, fibroblasts, cardiac myocytes, everything in blood vessels and lymph nodes. These are very important for our body to know exactly what it needs to do and when. So nitric oxide is one of the most well-known free radicals. It is essential for blood flow and neural activity. I could do an entire day lecture just on the importance of nitric oxide, but for the sake of trying to keep this a little bit quick, I'm not going to go into it too much. But oxidative stress happens when free radicals start to accumulate in more than those normal levels. So they cause oxidative stress. And oxidative stress contributes to diseases, accelerated aging, and sudden onsets, stroke, trauma, heart attacks, things like that. So like I said before, free radicals at a normal level, they're there for a reason. They help us process things, they help us protect from things. But once it goes a little bit wonky is when we start having issues. So diseases that are linked directly to oxidative stress: cancer, cardiovascular disease, Parkinson's, Alzheimer's, ALS, multiple sclerosis, and then things like depression, memory loss, asthma, COPD, rheumatoid arthritis, renal failure, delayed puberty, and so much more. So when you think about, okay, free radicals, damage in the body, these little tiny creatures in our bodies can cause so much issues when things are not running properly. So reactive oxygen species are actually in our body and they're part of our cellular respiration and they help cell signaling. Some are free radicals. And then apoptosis, and I referenced everything we talk about now will have a place later on how red light therapy plays a role in all of this. But apoptosis is when our cells are dying normally. And as soon as they become problematic is when things like tumors start. So apoptosis, everything's running right. It's eliminating unwanted or dysfunctional cells. It maintains our cellular health. Mm. Yes, but shrunk to half screen. Give me a second, guys. As far as shrunk to half screen, what are you seeing other than that screen? Oh, okay. Yeah, you should be able to drag it around. I didn't add myself as a camera person to see me just because I didn't want it taking up the space in here. So to continue on, one of the biggest leading causes of death in America and probably the world is cardiovascular disease. So that reactive oxygen species is actually a primary or secondary factor causing CVD. So ROS happens because your body is saying, hey, there's something going on. We're going to put things to it to make it heal. So it triggers inflammation, but in a bad sense, it triggers plaque buildup, and then it leads to more ROS production. So LDL oxidation by ROS creates foamy cells, and that will harden your artery and eventually lead to heart failure, which is terrifying. Just these things in our body that are supposed to be happening can cause us to have issues. So neurodegeneration and dementia. So ROS-induced neuron loss is directly linked to dementia and Alzheimer's, and toxic peptide formation is associated with Alzheimer's. So, and that's driven by free radical damage. And so it goes back to things that are supposed to help us actually can make it worse when our body's not functioning the way that it should. I'm going to take a sip of water for 1 second. So inflammation and chronic disease. So prostaglandin, as levels increase, things like arthritis, chronic inflammation become way worse. Prostaglandin is a direct contributing factor to pretty much just pain. So overload levels of it will cause more issues. Cytokine overproduction due to ROS inflammation causes fibrotic tissue formation. So it impairs organ function and potentially leads to organ failure. So I want to point out how much mitochondria we have in our body. And everybody knows ATP production, red light, it affects mitochondria. So your mitochondria are 5 times more prone to oxidative stress. So when you have something like the liver and the heart and your brain and nerves that are starting to have that stress, all your functions become less efficient or problematic. The only big pathway in our body that has no mitochondria is the blood. And that's because our blood is supposed to push all of our cells and all of our energy to other areas. Our blood should not be consuming that energy. So our mitochondria are the powerhouse of our cells. And we've learned this probably going all the way back to like 2nd grade science. But they take in oxygen, glucose, fatty acids, and it converts them into ATP, which is what we use our energy for. And then it recycles extra waste to recycle it back in and to use it to make more energy. Now, if these functions aren't working properly, that's how all of the things I talked about up until this point go on. So ATP provides energy for life. It moves our muscles, it sends signal to the brain, it builds new cells, and without it, we literally would dwindle down to nothing. Now, where does photobiomodulation come into play? That is what red light therapy is. That is what the medical and scientific community refers to when it comes to red light therapy. So the use of light that modulates those biological processes with energy, photons. They are absorbing the photons from this light. It saturates living cells with enough photons to recharge the cell's batteries to do their jobs better, to heal themselves. And then a little back history of red light. So where do we find it in our environment? It's actually the strongest at sunset and sunrise when the sun is at an angle that it filters through our layers of atmosphere, and you're getting the majority of red light. In 1967, Andre Meester was actually studying cancer patients. He was studying how their bodies reacted to radiation. And part of that was using a red light laser. And he noticed on shaved mice before surgery led to quicker hair growth and wound healing when they were exposed to the red light laser. And then it wasn't until the 90s that we started seeing what it could do for humans. And it was caused because we want to grow plants in outer space. We want to sustain plants in outer space. They found that the people that were exposed to that red light had faster healing, wound repair. There's a lot more benefits to it. But since then, they have funded thousands of studies on red light therapy to prove that it increases circulation, it helps energy production, it reduces inflammation, and so much more. When I am talking about red light therapy, I am talking specifically about our visible light spectrums. So anything that's out of that visible light spectrum doesn't truly have any benefits to your body, but it starts off at UVA, UVC, UVB, and then it goes all the way up to infrared. The deeper the wavelength, the longer the wavelength, the deeper it goes, with the exception of once you start going into infrared heat, it actually goes back up to about the, 0 to 1 millimeters into your body. So the longest wavelength is going to be infrared. Now, what happens when we shine light on our body? The light gets absorbed by our blood and our mitochondria, and then it fills up with as many photons as it can possibly hold. And then any extra actually pours into the bloodstream and neighboring cells. It benefits other areas of the body. If you've ever listened to Jerry from Poly, he talks about it like a halo effect. I think of it like a champagne waterfall. So I truly believe light is magical energy. So when red light is placed on the skin, it signals over 10,000 photochemical enzymatic reactions in the first second. It is absolutely amazing. The studies are growing thousands a month for red light being helpful for specific issues and then in general. And we only have scratched the surface when it comes to knowing what light therapy and red light can do for our bodies. But some of the known benefits that I'm going to talk about today are vasodilation, pain reduction, slowing aging, boosting COD, boosting our immune response, and reducing inflammation. So to go back and just paraphrase real quick. So ATP energy, so that is produced inside the mitochondria. It is regulated by cytochrome C oxidase, which is an enzyme in the electron transport chain. So the CCO absorbs the light and interacts with oxygen to optimize that energy output. So then going back to nitric oxide, so inside cells, it actually stops oxygen from binding and working the way that it should. So light therapy and or increased oxygen kicks out that nitric oxide, and then it allows that ATP production to get back on track. So inside the cell, nitric oxide is actually a negative, it's a bad guy. But once it's released, it's a vasodilator and it improves circulation and oxygen delivery. So when vasodilation happens, you are taking light from red and infrared mostly, and a little from yellow and amber light. But the light's going to penetrate the skin. It's going to reach those blood vessels. It's going to trigger, sorry, if you guys can't hear me say something, my computer just popped up saying you might have a degraded audio experience. Sorry about that. But it triggers nitric oxide to be released from the blood vessels, and then the blood vessels relax and widen. Because of that, increased circulation happens, and it's better, your body's better at delivering oxygen and nutrients to other cells. Blood pressure goes down because of vessel flexibility. And then the next part of vasodilation is it becomes better at taking in good things to the areas that need it and getting out the junk. So better circulation to extremities enhances overall health and supports heart function. And the body accelerates repair, it brings in healing factors, it removes that waste, and so much more. And then the next benefit is going to be a reduction in pain. Red light therapy literally blocks pain signals. So it blocks the pain signals that normally travel to the afferent neuron, and then it normally travels up the spinal cord, and then it goes to the brain. So that light therapy actually blocks or weakens the signal from the nerve. The signal never actually makes it to the brain. And while that's going on, it's decreasing inflammatory cytokines, which are key for our normal inflammatory responses. But when your body goes into overload, it produces too much. We are very familiar with the cytokine storm in COVID-19 cases. If people were in the hospital and they were on ventilators, that cytokine storm was actually very detrimental for those patients. So it actually reduces those responses. Not in a way that decreases healing, but just in a way that prevents that overreaction. And then it boosts mobility because by reducing the pain, by improving circulation, your range of motion is going to get better. And then when you are moving better, you're feeling better, you have less pain signal in the first place. All right, and then boost COD. So that is superoxide dismutase. It is a very powerful antioxidant found in every cell. It's mostly made in the liver, but it is made in other areas of our body. It neutralizes harmful free radicals. It protects our cells from oxidative stress. Not 100% sure what happened down at the bottom. I have a little bit. So it triggers antioxidant enzymes is what I covered up. But it protects the cells from oxidative stress. It stimulates those mitochondria, which increases ATP and improves cell repair and defense. So when it triggers antioxidant enzymes, give me 1 second, I just need to push this back up. Cellular pathways. Ooh, I'm gonna move this real quick. Cellular, give me a second. Trying to edit this live so you can see the bottom. Okay, cellular pathways are activated, which leads to higher SOD production, which reduces oxidative stress at the cellular level. So SOD is going to be vital in keeping your body at a healthy young state. Remember, your mitochondria are 5 times more prone to oxidative stress. So when that SOD is increased, all of the negatives start to subside. Celebrities are using and promoting red light therapy like crazy. Unfortunately, that has trickled down into the aftermarket production of a lot of stuff that's not going to work well. I'll talk about that in a minute. But they're mostly using it to promote anti-aging. Red light therapy reduces fine lines and wrinkles. It protects collagen and elastin from oxidative damage. So when your cells for your skin are damaged because of everything that goes on in life, it starts to age us faster. So it helps skin cells regenerate, it improves texture and elasticity, it fights inflammation and redness because it lowers that oxidative stress, which is literally associated with the redness and inflammation. It supports that cellular longevity. So it protects your DNAs and cell membranes from damage. It enhances overall skin and tissue repair to slow down aging. Everybody wants that. And it's not just physical looking, it's everything inside of your body that so you're going to feel good and you're going to look good when you're getting the right amount of red light. The biggest thing for me is an immune system boost because it goes into everything we've talked about so far and how it just helps your body function day to day. So it enhances your immune function. It stimulates macrophages and promotes that phagocytosis. So it helps your white blood cells remove bacteria, dead cells, and cellular debris, and it helps to get all the good guys in there quicker. It aids in liver and kidney function. So you're going to have increased blood circulation to the liver, and then your liver's better at processing out all that toxin and junk, and then it supports your kidneys then filtering it out of your body completely. And it supports cellular detox. So that mitochondrial function that is now boosted and better, it helps cells eliminate those toxins more efficiently, enhancing detox pathways. So everything's kind of in an infinity loop, helping each other work. But if one area is not doing its job right, you're not going to have good toxin release. You're not going to have good blood flow with healthy circulation and good nutrients. And then one of the best parts of this is that apoptosis is going to be boosted. So light therapy influences gut, liver, lung health, all of the things in your body that are made to actually protect you. So it supports a great balance in your system, and it contributes to anti-tumor effects. So when apoptosis isn't working right, those things can lead to abnormal growth and tumors and eventually cancer. So we need all of these functions running at prime to be prime. And so this one's a little bit long, but that is because at the core of it all, pain is what makes our body go crazy. And so pain is a symptom of the disease process of inflammation. So give me 1 second, I'm going to take a sip of water. So red light therapy modulates inflammatory responses. It helps regulate the body's natural healing process. It prevents that prostaglandin overload that we talked about earlier. So prostaglandin is lipids that are made during tissue damage or infection that regulate inflammation, blood flow, other processes like hormones. It reduces the overload that leads to excessive inflammation linked to cramps, arthritis, and chronic pain. Red light therapy mitigates oxidative stress. It enhances antioxidant activity to neutralize harmful ROS species. So those reactive oxygen species that are great in moderation, once they are too much, they disrupt that apoptosis of your cells dying normally and regularly. And then it supports cellular repair. So DNA, RNA, proteins from damage, it promotes healthier, longer cells overall. Give me 1 second, I've got a question here. Somebody asked if they'll look like one of the celebrities if you do the red light therapy. I have a feeling you'll look way, way better than them. All right, so getting into the nitty-gritty of how we can utilize red light therapy to help our body. Time versus efficiency is a huge factor when it comes to light therapy. And the one description that really sits with me is, say you're in the middle of a drought and you need to water your flower garden. What is going to be better? A slow sprinkler that's going to slightly water over time, or putting a fire hose directly on one of the plants? If you're going to put a direct hose of full pressure on the plants, you're going to destroy the plants. You're going to destroy your garden. So we need to be releasing red light therapy in a time that actually makes sense for our bodies. Too much light in a short amount of time overwhelms our cells. It leads to lack of results or actually too much stress. So it's important to avoid a thing called a biphasic response. And that's when your cells are overstimulated, because it can accidentally do the opposite of what we're trying to do and lead to more oxidative damage instead of healing. So moderate, longer duration exposure really does allow for the most beneficial mitochondria activation. So it's going to help with ATP production more, circulation and anti-inflammatory responses more. Muscles and tissues respond better to lights over an extended period of time rather than quick intense. And I'm going to get into that a little bit more. But if you have something that's going to give you your therapeutic dose in like 2 minutes, 99% of the time, it's not really going to do anything for your cells, because your cells are just drenched by that fire hose. They don't have time to absorb it, take it in, and process it. So how much light do we actually need? For skincare, I like to see 5 to 15 joules per session. When you achieve that amount of red light therapy, you're going to stimulate collagen, you'll reduce wrinkles, you'll blur fine lines, improve skin tone, and help texture. Emotional well-being. You want to get between 15 and 30 joules per session. It helps with serotonin levels. It boosts dopamine levels. It aids in cognitive function. It reduces anxiety and depression. Now, the daily goal that I like to aim for, and it's great for pain relief, that's acute, like you got injured, is 30 to 60 joules. It decreases inflammation, it improves your blood flow, it repairs tissues, it speeds up recovering time. Now, I have the 60 to 100 joules bold because most people are not going to need this much. When I have clients coming to me for pain, chronic, debilitating, they've been fighting with it for a while, this is what I'm going to aim for daily or every other day because it does help your pathways get a readjustment. It regenerates nerves, cartilage, and tissue. It improves mobility, reduces stiffness. You do risk at that point, though, having some negative reactions. And what happens when we get too much light? And this can vary by user, but like tanning, you do want to start low and build up slower, especially with units that are going to give 30 to 100 joules a session. Anything less than that, I'm confident enough to say that people won't have a bad reaction to, but it depends on a person. So it's called a Herx reaction when your body starts to freak out when you had too much. It's if too many toxins or damaged cells are released, our bodies struggle to process and eliminate them. So when you shine light on your body, all those detox effects start taking place. And if your body is too stimulated, it's just going to hang out there instead of doing what it should do and get rid of them. So that quick and intense inflammation response can also happen before healing starts. So you want to get that proper dose. So there might be a little bit of a reaction simply because your body's waking up and doing something. And then the immune response overload can cause detox-like symptoms. And so if you're releasing all these toxins, your body's not functioning out, it can cause flu-like symptoms, headache, sluggishness, exhaustion, body aches, dehydration. And I'm going to say you need to make sure you are drinking a ton of water if you're doing therapeutic doses of red light because your body needs to be able to flush everything out. But too much can cause itching, it can cause hive, it can change the color of tissues in the skin, it can cause your skin to stay hot for hours. You might get a rash, you might have no noticeable improvements, or your symptoms can actually start getting worse. These can happen anywhere from hours to day after a session, which we can relate in the tanning world to. Okay, somebody might overdo it in the tanning bed, but they're not going to feel it until later or even the next day or the next day when they tan again, and that day is going to start giving them too much sun. So if something like this happens, it's important to take a break, flush your system, go back and start a little bit slower. Some people might never be able to get up to 60 joules in a session, and that's fine. Their body might do better at just getting 20 to 30 joules for those pain relieving doses. Now, you have to open your lymphatic ways when this happens. I don't have a slide about this, but a vibration panel, or if you have a pod that has a vibration mat in it, that is actually amazing for opening up your pathways. And if you are into photopuncture therapy, which is what I do, that's my specialty. It's acupuncture, but without needles, it's with light. There are lymphatic drainage pathways that you can open up as well. All right, now, big question. How the heck do we know how much joules we're getting? How do we know what our red light therapy is putting out? In a reputable company, they are going to know the milliwatts per centimeter squared their device is putting out. There are a lot of companies out there that will take that number, convert it into joules, and then times it by their 18,000 diodes that they have in their bed. That's not actually how it works. Whatever output you're getting is where you get it your entire body. Just because there's more lights doesn't mean you're getting more joules. You're just getting those joules to more area of the body, if that makes sense. So when we know the milliwatts per centimeter squared, I am a big fan of metering our equipment. Give me 1 second. We have a question. I only do the vibration. Somebody asked you do the vibration before red light session. I only do it if somebody is having a Herx reaction. It does not hurt though to open up those pathways before though. I just don't regularly do it due to time. Give me 1 second. I'm just seeing if there's any other questions. No, okay. So I meter all of my equipment. Just like I meter all of my tanning equipment, I need to make sure my devices are running the way that they should. And depending on what meter you have, some are very over intense. I ended up getting one off of Amazon that said my one device that normally gives about 67 milliwatts per centimeter squared, it said it was giving 6,700. So I'm not going to say which brands I like, but if you have a device that is very, I'm going to give Poly for an example, because Poly, what they say that comes out for milliwatts per centimeter squares is what it comes out with. So you can test your meters to a reliable device to make sure other devices are up to par. But once you know your milliwatts per centimeter squared, I like to put it where it's going to be on the body. So if it's not a mat and you're not laying directly on it, say you're in a bed and it's over you, I will physically lay down in the bed and hold it where my body is so I know what light is reading at my body level. So you're going to take that, you're going to times it by 60 seconds. I will tell you what Poly reads in a little bit. I'll actually go into a couple different things of what I get for readings. But you'll times it by 60 seconds, and from that, you're gonna times it by 0.001 or divide by 1,000, whatever is easier for you. But that is how many joules per minute you will get. So let's take a device that is reading 100 milliwatts per centimeter squared. Times that by 60, you get 6,000. Times that by 0.001, you're going to get 6. So that device is giving 6 joules per minute. To get a decent therapeutic dose, you would only have to use that device for 10 minutes. All right, now, there's a lot of information out there that says red light therapy is amazing for all, and you really don't need to worry about waivers or anything like that. Unfortunately, that is not the case, especially if you are doing therapeutic doses. If somebody has low blood pressure or are taking nitrates, it can cause a further drop in blood pressure. The last thing we want is somebody who has low blood pressure having their blood pressure go lower and then they're passing out, or they feel like they're going to pass out, and you have somebody that is white and clammy and not doing very well in your spa. Epilepsy is another risk, and that is because light, even though we can't see it, has frequencies and it's moving. Epileptic people can have a seizure trigger because of that. Now, the next one is a caution. So if somebody has active cancer or malignant tissues, there is a fear that because red light therapy makes cells work better, that red light therapy may make cancer cells work better at being bad. Now, this is not studied very well either way, and I will say on my behalf, if, and knock on wood, I never have, never will, but if I had some sort of carcinoma or malignant tumors, I would be supporting my body in a function that boosts overall. I would be using it, but this is a conversation for that patient to talk to their doctor. So as a patient of a different doctor, they need to talk to their doctor about this, but it may stimulate that cell activity to be more cancerous, which is what we don't want. So I've always said, don't light up that area. That's what I personally will say, but they have to talk to their doctors first. Now, if somebody's taking blood thinners, hemorrhaging, or if you've been following me behind the scenes, have a head concussion because you were running and you slipped and fell on ice and slapped your head against concrete, you don't want to increase the risk of bleeding. So red light therapy boosts circulation. It can make bruising worse and it can prevent clotting. So in cases of like head concussions, you want to wait 48 to 72 hours afterwards so you don't make any bleeding in the brain worse. But if somebody is hemorrhaging, they're probably not going to you anyways, but they might be at home asking you if they can do this. And you want to talk to your doctor first, really, but it can increase the bleeding, which is not a goal that we want. Now, active bleeding, it's the same thing other than menses. It's that heightened bleeding concern. We do not want to push when something is so fresh that it could make it worse. Now, pregnant or breastfeeding, contagious or infectious conditions, these are precautions because they're not really studied and it may pose a risk. There are specific areas in the body that should not be lit up by if you're pregnant because it can increase prostaglandin production, which can induce labor. So we want to be very careful. I would red light daily if I was pregnant. And breastfeeding, I would avoid that area just in case it would dry up. But like I said, there's not a lot studying done on either side. So we need people to be talking to their doctor if they have any low blood pressure, epilepsy, cancers, blood thinners, or needing to take blood thinners, bleeding, pregnant breastfeeding, or if they have any contagious or infectious conditions. All right, now to get on to something that I am very strongly impassioned about is what the FDA actually recognizes red light therapy to do without jumping through any hoops. And that is it reduces inflammation and pain, it increases circulation, it stimulates cellular repair and regeneration. So it's great for muscle recovery. Unless your device is registered with the FDA for something else, this is all you can legally say your device does. We cannot say that this is going to reduce heart failure or this is going to even reduce fine lines and wrinkles unless that device is proven and registered to do so. I don't go into it in too much on this, but the FDA, the FTC are very, very observant of people and practices making false claims. And this happens when people like us are giving a service and they start saying things that their device doesn't do, you then step into the role of a device manufacturer, you can be sued by the FDA. Normally, we do see this on a broader scale. The device equipment manufacturer, they start going off the rails and claiming things that their device isn't approved for. They get a cease and desist by the FDA. Beyond that, they will get sued. A huge reason why insurances are having such a hard time covering red light therapy in general is because people are making so many claims that can be construed as practicing medicine without a license. That is a whole nother ball game that opens you up to liability lawsuits because we are not doctors. We are not medical licensed. We are not in a role that we can be prescribing and treating and making claims that don't align with what the device is registered for. So things like Poly. Poly has a registration for the reduction of fine lines and wrinkles, the reduction of pain, the treatment of acne. Those are things you can say with Poly because their device has been registered. You will not get in trouble for saying that's what that device does because they have the medical backup for it. So even licensed medical doctors actually need to consult with their board to see if light therapy is in their scope before they can call themselves a provider of red light. So up until they get the okay from their board, they can only call their clients clients. It's not until the doctors are like, yes, we can treat, is when they can call them patients. We are never allowed to call our clients patients. We are not doctors. You are crossing a horrible legal line that is going to open up scrutiny from the FDA, the FTC, as well as the medical field. So never, 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 never use the word like this is going to prevent heart disease. We know the benefits of red light. We can talk about the general benefits of red light, absolutely, but we can't say our devices do that. Much like we can't say our tanning beds will produce vitamin D for your body. The FDA specifically has gone after that. Whether or not it's going to change in the near future, I do firmly hope so, but we can't say it. We cannot make those medical claims. So you don't want to say that you can evaluate them for a disease. You don't want to say you can heal them. You don't want to say like, ooh, I can identify what's wrong with you. You shouldn't be making medical claims. You should never make promises that we can't keep. So even if a device is made to reduce fine lines and wrinkles, because we don't have anything to protect us from like medical claim lawsuits, I would never make claims and promises that I know I can't keep and back up. But we can never see patients. We should never call our clients patients. We should never insinuate that we treat patients. We cannot prescribe treatments at all whatsoever. It is very bad and negligent advice to say, yeah, you can take a 30-minute online course and now you can prescribe treatments to patients. You will get sued by many different people eventually if you keep making these claims. So you need to stick to your device's registration with the 510K. And there's many different kinds. There's the general, because red light is just accepted as not harmful. So there's just that general, like, yep, we are 510K exempt, and that means our device is good for pain relief, inflammation reduction, and a healthy circulation boost. That's all you can say. If that 510K is then extended on and shows that it's good for acne, or it's shown that it's good for hair loss, or it's shown that it's good for true pain reduction, that's when you can go and start saying these claims. Ask your device manufacturer what their 510K is. If they don't have one, you are very limited to what you can say to, let me see if I can go back. Yeah, to these three things: reduce inflammation and pain, increase circulation, stimulate cellular repair, regeneration, or muscle recovery. They don't have to get the 510K registrations, but in my opinion, it's that next step to be able to use a device in a way that helps us advertise it better. It's also proven safe and it's proven effective at what they're claiming it to do. If you follow me on TikTok, you guys have seen, unfortunately, how many products out there don't do anything, next to nothing, or you have to use it like 7,000 minutes to get even a light skincare dose. All right, I have a bed that I put hybrid lamps in. It gives me 1 joule of red light therapy over the 20 minutes. I have a all hybrid lamped unit that gives me 3 joules of red light in a 11-minute unit. Now, all of your devices are going to be a little bit different depending on their output and how much time they are. My hybrid bed with LED pearls, it's going to give anywhere from 1 to 3 on the body up to 3 to 5 on the face, just depending on how close you are to it. The unfortunate thing with red light pearls being so far away from the body is they produce a ton of red light, but the farther away you go, it decreases it significantly. And then I have a bed that has all fluorescent LED red lamp, not LED, just fluorescent tube red lamps. That gives about 10 joules over the 20 minutes. So that one's good for a light skincare dose. And then I've got just the LED body panels. And then this one is going off of where I have people laying underneath it. It gives 30 joules over 30 minutes. And then this is what my poly reads at, 86.3 milliwatts per centimeter squared. You're getting relatively anywhere from 60 to 70 joules, just depending how far away you are from that. And should we be making claims if we have those hybrid units? And so this one is a big area to be worried about, because I have seen people start making medical claims about the red light in tanning units, when unfortunately it's not enough joules to actually have those great benefits. So red light, when you add it to tanning, it helps to decrease inflammation, it reduces after tan redness, it offsets oxidative damage to DNA by tanning, it promotes a longer and deeper tan if it's a skincare dose. So if it's only given like 1 to 2 joules or even 3, I wouldn't really be even claiming this personally. But if it's over 3 joules, you can confidently say that it's going to help that. Now, we can't claim red light boosts vitamin D production in our tanning beds because we can't say our tanning beds provide vitamin D. But I will always say sunshine increases vitamin D levels, and red light out in the wild before sun exposure does help provide better vitamin D production. Just don't say your unit provides that. So it's really not strong enough to promote other benefits, and we can't make those medical claims for red light, let alone tanning. So just keep that in mind when you are advertising, especially in a way that is shareable. You want to talk about the in generals. Now, last thing I want to talk about before I try to answer any remaining questions is going to be products and red light. Should we use them? Should we not use them? Same thing with tanning. Dry skin reflects light. So hydration is key inside and out. I did a very unscientific study and I published my findings in IST magazine. I took a light, I read it, and it was like 100 milliwatts per centimeter squared. I then put it over my glass shelf at my spa, and then I read it through the glass, and it decreased it down to like 80. So just going through the glass reduced it. And then I started putting different products on. What I found was products that were specifically made for red light did not lower the amount of red light going through. And in some cases, it actually boosted the amount of red light going through, which I thought was really, really cool. But products that typically were not made for red light either severely reduced the red light or went down to nothing. Give me 1 second. I do have. So saying that some of our clients have had an improvement and noticed benefits is, I think, safe because you're giving a referral. What I would do is try to get people to give you a documentation that you can share. Like so-and-so did this, and this is what they experienced. And then I wouldn't associate it too much per room, but I don't see why not if it's a customer testimonial. But you do start getting onto those fine lines of claiming it does something that it's not medically cleared to do. But red light in general is known for that inflammation decrease. So it's known for that pain relief. Those are safe things to talk about. I think I'm getting all the questions answered. It only comes in one by one. I apologize for that. All right, so that was actually the last thing I wanted to talk about, though, was what products should and we shouldn't do. The one study that I always refer back to and I love is the one that shows soaking cotton balls in green tea and letting it sit on your skin for like 20 minutes before you red light actually increase the red light production like 10 times. So people saw in 1 month better skin, fine line reduction compared to people who didn't use products that took 10 months to get them where they needed to go. So there are products that our tanning lotion companies have utilized that boost red light production in the skin and the benefits overall. So I do recommend using products that are good for red light. And ask your reps, ask your lotion companies that you go through which ones they recommend. What do we have? How about pricing for sessions? How do you figure a price range? So me personally, I charge $35 a session, and then I have a 30-day pass for $200, and then I have my membership at $100. It completely depends on what you have, though. And if I was just doing my one unit that gives 10 joules, I would probably do 25, with the therapeutic doses being a little bit more. I don't want to undervalue our services. If you compare your pricing to just places that only have saunas and red light and maybe they have some cryotherapy, they are charging premium dollars. And the last thing we need to do is undermine that to where we cheapen the value, because these units are not cheap. Our knowledge is not cheap. I really do like to price it a little bit better, but long term's the goal with red light. I only do encourage sessions for people that are already going somewhere else and they're in town and they want to do it. I'll always try for at least a month from people. What do we got here? I don't. Somebody asked, what do you rate the Body Balance ULT bed? I'm not familiar with that one. All right. Last but not least, if you mention this ad with Heartland and you order a poly, they will actually give you a credit, which is amazing. Thank you, Heartland, for having me. And I do have my monthly article in IST magazine. I always am learning. I am always researching. I am a big fan of, if you feel like you know as much as you're going to learn in a field, it's time to get out, because you are doing an injustice for yourself as well as your clients. So I am always researching, I am always sharing, and my biggest outlet is my TikTok, my YouTube, and then that IST magazine. So if you go on spraysunspa.com and click where it says Kristin Lee Smithers, CLT, I believe, there is a form there for a free intro course into the institution that I got my first certification from. And that's eventually who I used to pursue going deeper and getting my board certification from. Somebody asked, will we still get the discount if we just paid for it today? I would contact who you ordered with and say you were here and that you saw that, because I would hope so. So somebody said my left arm was crushed by a metal die. I had plates and screws put in. Give me a second. I'm trying to see if I can open this up. I started red light 10 days after surgery. My scar blends in with my skin tone. It helped with pain. Even my doctor was amazed at the effects I received from it. It really did help me heal better. Thank you for thank you for following me. I really do try to get everybody on the same page when it comes to this. But yes, I healed so much better and faster after my last surgery, which was a hysterectomy with a ton of issues that went along with it. And prior to that surgery, red light was the only thing that helped me get out of pain. Same thing with my arthritis. My arthritis has not gotten worse since 2016 when I had my one surgery for my knee. Somebody says, what do you think about the Beauty Angel red light therapy booth? I have not personally tested that, but typically the fluorescent ones are going to be good for skincare. That's what I have noticed. And somebody said Smart Sun Therapy. I have not personally tested that one either. I know they are the general FDA thing, so you can claim those three: reduction in pain, boost circulation, but I believe they give a therapeutic dose the last time I looked into that. Does anybody have any more questions while you have me just for a couple more minutes? Let's see. Trying to read through these guys, see if I missed any. I think I got everything. All right. If you need to get a hold of me and you have questions, KristinLeeSmithers@gmail.com. I spell it the tin way, not the 10 way. And then spraysunspa.com. If you click that Kristin one, I have so much stuff on there that you guys can utilize. And to get a hold of me, thank you very much. You also have a great day. That was, I saw Roger said that. And if I missed a question, please email me. All right. Whenever you're ready to log off, I'm going to take your guys' cue and I'll stay on here. There you go. Thank you guys again. Thank you, Heartland, for having me. Thank you, Ellen. Thank you, Michelle. anybody's left on here, I have a feeling you guys forgot or you got busy and it's just on in the background. All right, since it's officially 12:30, I am going to log out of here. Thank you all again and stay radiant.